Welcome to this session on the zygomatic bone. The zygomatic bones are paired bones of the facial skeleton. They occupy parts of the face, the orbit, the temporal, and the infratemporal fossae. The zygomatic bone is said to be quadrangular in shape, and it is described as having three surfaces: facial, orbital, and temporal, 5 borders, and 2 processes. This surface of the zygomatic bone is called the facial or the lateral surface. The surface here is described as the orbital surface. The surface which forms part of the temporal and the infratemporal fossa and also articulates with the maxilla is called the temporal surface. What are the borders of this bone? This is the anterosuperior border, and this forms part of the lateral and the inferior margins of the orbit. This is the antero-inferior border which articulates with the maxilla. The posterior-superior border is curved sinuously and it continues with the upper border of the zygomatic arch. This is the posterior-inferior border, which in turn continues with the inferior border of the zygomatic arch. The posteromedial border is this border which separates the orbital surface from the temporal surface. Of this border, this part articulates with the greater wing of the sphenoid bone, whereas this part articulates with the maxilla. The processes of this bone are 2. The process which projects superiorly is the frontal process. It articulates with the zygomatic process of the frontal bone at the frontozygomatic suture. This is the temporal process of the zygomatic bone, which articulates with the zygomatic process of the temporal bone to complete the zygomatic arch. So how do we determine the side of this bone? The features that we should take into consideration are the facial or the lateral surface, which has to be kept facing anteriorly and laterally, the frontal process, which has to be pointing superiorly and should be on the lateral side. In that way, this border, the curved border, which is the posterior-superior border, will project posteriorly, and these help to determine the side of the bone. So, with all the anatomy that we have learned so far, can you think of any muscles or structures that will be attached to the zygomatic bone? You could pause this video for a second, think of the answer, note it down, and then press resume. So, you might have thought about zygomaticus major and minor muscles. You might have also thought of any. You could have thought of the temporal fascia, the masseter, or in turn you could have also thought about any structure in the orbit or any ocular muscle. So let us take a look at the features of these surfaces and borders. The lateral surface or the facial surface shows one foramen. This is called the zygomaticofacial foramen, which transmits zygomaticofacial nerve and vessels. Below this, there are the attachments of the zygomaticus major muscle posteriorly and the zygomaticus minor muscle anteriorly. At this medial projection of the lateral surface below the orbital margin, there is the attachment of levator labii superioris. The temporal surface shows another foramen, and this is called the zygomaticotemporal foramen. The surface forms part of the temporal fossa and the infratemporal fossa, and this triangular area articulates with the maxilla. On the orbital surface, we have the foramen called the zygomatico-orbital foramen. processes of the bone are the frontal process, and on the orbital surface of the frontal process, around 1 centimeters below the frontal zygomatic suture, there is a tubercle which is called the Whitnall's tubercle. It is important because there are four structures of the orbit which attach here, all of them beginning with an L, which can help in memorization of this: the lateral palpebral ligament, the lateral rectus check ligament, Lockwood's suspensory ligament of eyeball, and the levator palpebrae superioris aponeurosis. The zygomatic process of the temporal bone articulates with the temporal process of the zygomatic bone and completes the zygomatic arch. And the temporal fascia is attached to the zygomatic process as well as to the postero-superior border of this bone. So what is the functional importance of this bone? The zygomatic bone is a prominent feature on the face, and because of this, it is often involved in fractures of the face and the zygomatico-maxillary complex. The facial process is a very thick part of bone which serves as a buttress, meaning it transmits the masticatory stresses from the molar and the premolar areas to the base of the skull. In certain populations, the zygomatic bone is seen as two segments, a large superior segment and a smaller inferior segment, which is called the os japonicum. Thank you for joining us with this session on the zygomatic bone.